The latissimus dorsi is the broadest muscle of the back. Its thin superficial fibers originate at the low back, ascend the side of the trunk, and merge into a thick bundle at the axilla. The teres major is called Lat's little helper because it is a complete synergist with the latissimus dorsi. It is superficial and located along the scapula's lateral border between the latissimus dorsi and the teres minor.
Let's begin by engaging the latissimus dorsi. I'm going to ask my partner to medially rotate his shoulders. And how that'll happen is I'll ask him to just go ahead and try to press his hand into my leg, which is conveniently there. And as he medially rotates the humerus, there we can see all of that latissimus dorsi and the teres major engage. And while he continues, I can really feel that tissue as it converges and funnels into the axilla. Go ahead and relax. And sure enough, all of this tissue now softens up. Good. So let's begin with the latissimus dorsi. Probably the easiest way to get your hands on some of it is to sort of scoop up that lateral edge right there. And if I'm not quite sure if I'm on it, I can ask him to medially rotate again. So he's going to press his hand. There you go. And all of this tissue suddenly gets much more difficult to lift up. Good, and relax. Now, I'm not grasping this. This is skin. And you can tell it's skin because it's sort of gelatinous and it doesn't have any, well, meat to it. But if I reach in a little more, all of this is going to be the latissimus dorsi. And it certainly gets much thicker as it converges and bundles right here on the posterior axilla. And then as I follow it inferiorly, it becomes much thinner as it merges into that thoracolumbar aponeurosis, that big piece of fascia on the low back. So if this is my latissimus dorsi, where's going to be its synergist, the teres major? Well, the easiest place to start is to find the lateral border of the scapula. So I'm just going to sort of work my partner's shoulder here a little bit. And there I can find the inferior angle of the scapula. And if I walk my thumb along that edge, there I can find the lateral border, which is where the teres major will attach. So if I ask my partner to go ahead and engage again and try to medially rotate, wow, it's a very dense mass of muscle tissue running right off that lateral border. Good, go ahead and relax. And so I can access it directly, just right on top of the muscle belly, right there. Or I can scoop up underneath, sort of taking the latissimus dorsi with me, sort of like grabbing a hamburger. And there I can feel the teres major underneath my fingers, like so. Very accessible tissue. Thank you. Finally, we can lengthen the teres major and latissimus dorsi by abducting the shoulder, laterally rotating it, and even bringing it up like so. And then finally, we can shorten the muscles by bringing the arm next to the body like so, which adducts the shoulder joint. We can also access these muscles in a supine position. I can take my partner's arm and flex the shoulder. And then if I ask him to try to bring his elbow toward his hip, go ahead and extend. There you can see a fabulous example of how the latissimus dorsi comes up on the side of the torso and coming into here at the axilla. And go ahead and relax. And I can really get my hands on that flap of tissue here on the side of the torso. And as I come up closer, I find that there is the bulky tissue of the teres major. Good. And finally, this is a nice place to also lengthen and shorten the muscle. To lengthen these muscles, I can bring the arm up overhead to full flexion, and to shorten them, of course, bring the arm back to the side into a neutral state.